And welcome everyone. Myself Mizanur Rahman, and today my topic of discussion is periodic breathing. So, what is periodic breathing? Periodic breathing is the abnormal or uneven respiratory rhythm. It is of two types. One is Cheyne-Stokes breathing, and one is Biot breathing. So, first, Cheyne-Stokes breathing. Features of Cheyne-Stokes breathing. Cheyne-Stokes breathing is the breathing in the periodic breathing that is characterized by rhythmic hyperpnea and apnea, and it is the most common type of periodic breathing as it is marked by two alternate patterns of respiration. One is hyperpenic period, one is apneic period. So first, the hyperpenic period, that is waxing and waning of breathing. To begin with, the breathing is shallow, but force of the respiration increases gradually and reaches the maximum or hyperpnea. Then it decreases gradually and reaches the minimum, and it is followed by the apnea, and gradually increase followed by gradual decrease in force of respiration is called waxing and waning of breathing. First, the apneic period, when the force of breathing is reduced to minimum, cessation of breathing occurs for a short period. It is again followed by hyperpenic period and the cycle is repeated. Duration of one cycle is about 1 minute. Sometimes waxing and waning of breathing occurs without apnea. Now, causes for waxing and waning. Initially, during forced breathing, the large quantity of carbon dioxide is washed out from blood. When partial pressure of carbon dioxide decreases, during the centers become inactive and it causes the apnea. And during the apnea, there is accumulation of carbon dioxide, hyperpnea, and reduction in the oxygen tension or hypoxia. Now the respiratory centers are activated, then it results in gradual increase in the force of breathing. And when the force of breathing reaches maximum, the cycle is repeated again and again. That is, here it is the diagram. We will discuss later. No, sorry, we are discussing now. So first, we start from waxing. Gradual increase in rate of force of breathing, that is waxing, then removal of excess carbon dioxide, then decrease in partial pressure of carbon dioxide, then activation of respiratory centers, that gradually decrease in rate and force of breathing, that is waning, then apnea, then hypercapnia and hypoxia, then increase partial pressure of carbon dioxide, then activation of respiratory centers, then again waxing. Now, condition when Cheyne-Stokes breathing occurs. Cheyne-Stokes breathing occurs in both physiological and pathological condition. Physiological condition when a Cheyne-Stokes breathing occurs during deep sleep, in high altitude, after prolonged voluntary hyperventilation, during hibernation in animals, in newborn babies, and after severe muscular exercise. Pathological condition when Cheyne-Stokes breathing occurs during the increased intracranial pressure, during advanced cardiac disease and leading to cardiac failure, and during advanced and renal diseases leading to uremia and poisoning of narcotics, and in premature infants. Now, biot breathing. Features of biot breathing are: biot breathing is another form of periodic breathing characterized by a period of apnea and hyperpnea, and waxing and waning of breathing do not occur. You can see in the diagram. This is 1 to 7.2. It's diagram 1. And after apneic period, the hyperpnea occurs abruptly. Then causes of abrupt apnea and hyperpnea. Due to apnea, carbon dioxide accumulates and it stimulates the respiratory centers, which leads to hyperventilation, and during hyperventilation, lots and lots of carbon dioxide is washed out, so the respiratory centers are not stimulated and apnea occurs. Then condition when the biot breathing occurs. Biot breathing does not occur in physiological condition, it occurs only in pathological condition. And it occurs in condition involving nervous disorders due to lesion or injuries to brain. Now the cyanosis. Cyanosis is defined as the diffused bluish coloration of skin and mucous membrane. It is due to presence of large amount of reduced hemoglobin in the blood, and quantity of reduced hemoglobin should be at least 5 to 7 gram per dl in the blood to cause cyanosis. Now, distribution of cyanosis. When it occurs, cyanosis is distributed all over the body, but it is more marked in the certain regions where the skin is thin. These areas are lips, cheeks, earlobes, nose, and fingertips above the base of the nail. And condition when cyanosis occurs, any condition when leads to arterial hypoxia, stagnant hypoxia, then the cyanosis does not occur in anemic hypoxia because the hemoglobin content itself is less. It does not occur in histotoxic hypoxia because of tissue damage. Number two, that is conditions when altered hemoglobin is formed due to poisoning. Hemoglobin is altered into the methemoglobin or self hemoglobin, which causes cyanosis, and the cyanotic discoloration is due to the dark color of these compounds only and not due to reduced hemoglobin. Number three, that is condition like polycythemia when the blood flow is slow during polycythemia because of increased RBC count. The viscosity of blood is increased and it leads to sluggishness of the blood flow. So the quantity of deoxygenated blood increases, which causes bluish discoloration of skin. Then cyanosis and anemia. Cyanosis usually occurs when the quantity of reduced hemoglobin is about 5 gram per dl to 7 gram per dl. But in anemia, the hemoglobin content itself is less, so cyanosis cannot occur in anemia. Now, carbon monoxide poisoning. Carbon monoxide is a dangerous gas since it causes death. This gas was used by Greeks and Romans for the execution of criminals, and carbon monoxide causes more death than any other gases. So, what are the sources of carbon monoxide? The common sources for carbon monoxide are exhaust of gasoline engines, coal mines, gases from guns, deep wells, and underground drainage system. Now, what are the toxic effects of that carbon monoxide? Carbon monoxide is a dangerous gas because it displaces oxygen from hemoglobin, and by binding with the same site in hemoglobin for oxygen, so oxygen transport and oxygen carrying capacity of the blood are decreased, and hemoglobin has got 200 times more affinity for carbon monoxide than for oxygen. So even with low partial pressure of 0.4 mm per Hg of carbon monoxide in alveoli, 50% of the hemoglobin is saturated with it, and it can be dangerous if the partial pressure increases to 0.6 mmHg 1 by 1000 of volume of concentrated air, and presence of carboxy hemoglobin decreases the release of oxygen from hemoglobin, and oxygen hemoglobin dissociation curve shifts to left. And it is still more dangerous because during carbon monoxide poisoning, the partial pressure of oxygen in blood may normal in spite of low oxygen content of blood. So the regular feedback stimulation of respiratory centers by hypoxia does not take place because normal partial pressure of oxygen, and however low oxygen count in blood affects the brain, resulting in unconsciousness, and the condition becomes fatal if immediate treatment is not given. Now, carbon monoxide is toxic to the cytochrome system in cells also, and symptoms of carbon monoxide poisoning. Symptoms of carbon monoxide poisoning depends upon its concentration. While breathing air with 1% carbon monoxide, saturation of hemoglobin with carbon monoxide becomes 15 to 20%, and mild symptoms like headache and nausea appears. And while breathing air containing carbon monoxide more than 1%, the saturation becomes 30 to 40%, and it causes convulsion, cardiorespiratory arrest, loss of consciousness, and coma. And when hemoglobin saturation is above 50%, death occurs. Now, what are the treatment for carbon monoxide poisoning? So, the treatment for carbon monoxide poisoning includes immediate termination of exposure to carbon monoxide, providing adequate ventilation and artificial respiration, then administration of 100% oxygen if possible. It is to replace carbon monoxide, and administration of air with few percent of carbon dioxide if possible. It is done to stimulate the respiratory centers. So this is for now. In the next video, we'll discuss more about the disorders of breathing. And if you have any query or any doubt, you can comment down in the comment section. I would like to reply them also. And if you have any question, you can comment down also, and suggest me any topic if you want videos within it. And thank you so much for watching the entire video, and do like, share, and subscribe to my channel for supporting me and my channel. And thank you so much for watching the entire video.